Hi ladies, this is not a rant, this is just strictly a video that I felt like I needed to make, and I'm sorry for the way I look. It's Saturday, I don't film on Saturdays because I try to spend it with my husband. I want to talk about my health. Evidently, some people have some issues with comments that I've made about my health in, I guess, other people's videos or wherever. When I do that, it's strictly letting them know that, I could relate if it was a depression video, anxiety, abuse, just showing my support and that I could relate. Not trying to take away from anybody's video or pity or attention. That's why I have not made a video until now. I'll try to make this real short. In 2009, because I'm not going to be like Jessica, and you all that know and been with me long enough know who I'm referring to. I will actually show you proof. This is from the Social Security Administration, and where my disability was found fully favorable in 2009, and that was strictly for fibromyalgia. So I take over 20 different medications a day. Most of them I take between 2 and 6 of each of those medications. No, I'm not consistent with my videos. If you'll notice, a lot of the times I'll have the same clothes on for like either 2 to 4 or however many I did that day, because I was having a good day. So I try to do as many as I could to get caught up, so I could at least, post one every other day or one a week if I wasn't having a good day. The things I've been diagnosed with is fibromyalgia. Fibromyalgia was caused is usually from a traumatic instance, like a car wreck or whatever, and that was my case. I went through 3 months of physical therapy. Fibro is very hard to diagnose. There is no blood test for fibro. So they make you go through physical therapy. I went through chiropractors, and they also test for other things that they do have blood work for and that have similar symptoms to rule those out. So once all that's done, then that's how they determine that is what in fact you have. I also have Lyme disease. When I say I have Lyme disease, it is current and it is active because it was not diagnosed until last year. I have had it since 2006. And if it wasn't for me telling my doctors to take me off all these antibiotics and medications, because they were getting false negatives. So I went off all the medications, dealt with it, they retested me, and it came back positive. This is just lab results, so you can make sure you see my name. And it says gray because my husband and I didn't get married until December of 13. And these are just strictly lab results from biopsies, CT scans, MRIs, bone marrow biopsies, things like that. Here is the CD of the brain MRI, which is down here at the bottom, which shows the issues that I do have with some bleeding on the brain and where I have had strokes. This one is of my left thigh. And the reason I had one on my left thigh is I also have Sweet syndrome, which is a very rare disease. 1 in 9 million, usually women, of my age range get it. When something is called a syndrome, there is something else underlying that's causing it. The things that they do know cause it is Lyme disease, lupus, and cancer. They don't know enough about it to treat it. What it has done to my left thigh, it started at my hip and is now down past my knee, and every tissue layer down to my muscle looks like hamburger meat. If I stand up, it looks like my thighs are 3 times bigger, or they are 3 times bigger than what they should be, and it looks like somebody that weighed 500 pounds and lost 300 in 3 months. It just hangs there. And it is now in my right leg. It swells if I walk. It gets hot, it swells, it's painful. So they don't know how to treat that. So as it's deteriorating my leg, and I live at the beach and will not wear shorts or a swimsuit, not to mention anyway, I can't get in the sun due to one of the medications. You will sunburn more easily, and I'm fair complected as it is. These are from one doctor. And this is from the University of Tennessee. Hopefully you can see that. Which is also where I work. I worked before going on disability. I went on FMLA, then I went on short-term disability. I was a supervisor of the lab at the time. After 60 days, they do not have to hold your job, which they did not. They filled my position. So I did not have a job to go back to. I did not want to go on disability. So I went to St. Mary's Hospital, which I'm sure most of you have heard of. And I worked in their pain clinic doing their lab work of drug testing and such for a little over a year. And something happened and they decided to have a different lab or whatever, so I left there. So then I tried to keep working, and I worked for the University of Tennessee cardiologist, which consists of, well, at that time, 10 cardiologists. I just couldn't do it. You know, what I was doing was too important. I was working, with patients that could not be screwed up. And I wasn't going to take that chance because of the medications I was on and me not feeling well and being sharp on what I was doing. So as much as I didn't want to, I filed for disability. Well, when I did that, my husband at the time started cheating on me because I wasn't making the big money as a supervisor, and he filed for divorce. As far as abuse, I was in a relationship when I was 21 and had gotten pregnant. I had started the depot, which at that time was extremely new. I waited the 3 months, yada yada, I still got pregnant. And so he decided he didn't want the baby. And he made sure I didn't have the baby, and ended up having to have a D&C because the baby was dead. So after that, then I got cervical cancer that I dealt with. I had a leap and a cone done twice. The first time I had it done, you go back every 3 months to get it checked. And this is before the fibro. I'm going back to my 20s now. It came back. They did the surgery again. You know, it's a minor procedure. And at that time, I had finally started my disability, and I had no insurance. It came back again. I went to the health department. They would not do surgery. It took over a year and a half for me to finally get my disability. So I had to wait that long with the cancer back. I finally, when I did get insurance, went back to UT to my doctor, and they did a full hysterectomy, ovaries and all. So I never was able to have children. My husband and I were to adopt a child, a newborn, in February, end of February, which I have not really spoke about. That the week the baby was due, the mother changed her mind, which she and I talked every day, and I became very close to her. You know, this isn't a pity video. I'm just putting the facts out there so people who look at me and say, well, you look fine. Yeah, I do, and that's a problem. And then they read my comments and say, well, she's been through all that, but she looks fine. Because I haven't made a bunch of videos or series on depression or me sitting here crying and boo-hooing. I'm sorry. I didn't want to do that. And if any of my comments have ever offended anybody, I sincerely apologize. Because that was not my intentions. And those that truly know me, and don't just troll around watching my videos and comparing things, know that to be the truth. When I can't be filming, I'm laying in bed with my phone, watching and trying to support everybody else. Because I care. I'm not a liar. I don't have a GoFundMe account. No disrespect. As far as being bullied, since kindergarten, having mashed potatoes thrown at me from across the room, milk poured on me, glasses, braces, afro hair, no offense to anybody African American, fat, overweight, you name it, I was called it. Thought it would change in high school? No. So I skipped my senior year because I took AP classes. I never dated until college. Not one date. So those that want to believe me, fine. Those that don't, fine. But I think I didn't have to show you actual proof. But I felt like due to things in the past that I have to justify myself. So I'm not turning the thumbs up down on. This is strictly going on YouTube and nowhere else. I don't want it shared on Twitter. This is strictly for my YouTube followers. And I truly thank you, the ones that have supported me.